Hi, I'm Dr. Neuhaus, owner of Neuhaus Foot and Ankle. I've been in practice for over 20 years now, and I can't tell you how many amputations I've performed in that amount of time. How many people have lost toes, feet, legs, related to complications involving diabetes. It's literally something I do every single month. A lot of this stuff can be prevented if people know what to do. And that's where a podiatrist is so important in the care of a diabetic patient. So when you come to my office with diabetes, I'm going to do a very thorough exam. I'm going to feel your pulses, because circulation problems are very, very prevalent in people with diabetes, especially if they have a smoking history. And oftentimes that circulation problem goes undiagnosed because it doesn't hurt. People don't realize that loss of hair on their feet, their skin being a little bit shinier on their lower legs, or a little bit of swelling in the ankles can be signs of circulation problems. A little bit of cramping in your calf when you walk, or cramping in your foot at night where you got to get out of bed and walk to get the blood flowing. Those are all signs of circulation problems, and those are things that we look for with our patients. We do thorough nerve testing. Neuropathy is nerve loss, or it's a loss of nerve function, so you can't feel things. So we do a very thorough, complete series of tests to assess how your nerves are functioning. I always tell people that nerves are like taste buds. You can taste sweet, sour, bitter. You have different tastes on different parts of our tongue. Our nerves in our feet and our fingers are the same way, that we can feel sharp, we can feel light touch like cotton. We know if our arm is up or down. Those are all nerves that do that. Hot and cold, vibration. So we assess all of these different parts of the nerves and different types of nerves to know what your risk factors are for developing what's called neuropathy, which is basically your nerves dying, which in turn leads to amputation. We assess you for different deformities. Calluses can be potential hot spots where you end up developing ulceration, which is a wound. People with diabetes, especially those that have high blood sugar, tend to heal slower. So we talk to you about blood sugar. There's a lot of different things that we can do in the office to help you understand your risk factors and know if there's things you need to change in your life or things that we need to do for you to help prevent you from going down that road of potentially losing a toe or a foot or a leg. So I encourage everybody with diabetes to get in and see a podiatrist and understand what it is that you can do and what we can do for you so that you don't end up with an amputation.